Hi, everybody. Thanks for joining us again on the Healing Point Massage Therapy YouTube channel. My name is Alana, and I'm sitting down today with the owner of Healing Point Massage Therapy in St. Albert, Lianna. Hi, Lianna.
Hi, good morning. How are you?
I'm so great. The weather's been so nice. How are you?
It's like spring.
Yeah.
Yeah, doing well. Thank you.
It's definitely spring-like, but I don't think it's going to last.
It's not gonna. I just heard from the radio. Just enjoy it while it lasts.
Enjoy it. I didn't even bring a jacket today, but maybe I'll bring one tomorrow.
Yeah.
Excellent. The topic today is something that I'm very interested in as I have a child who's in this industry. We're talking all about nurses and healthcare workers and why massage therapy is beneficial for them. Lianna, why is this important to you?
Well, we have tons of nurses coming into the clinic, and they almost have like same exact issues. It's like
Wow.
there's a lot of common kind of issue with nurse working in the healthcare workers basically, and nurse. Mm-hmm.
Excellent. Yeah, I find that nurses and healthcare workers spend their entire day caring for everyone else, but their own bodies often pay the price. Long shifts on their feet, constant lifting and repositioning of patients, as well as the emotional toll that the job creates, tension, fatigue, and chronic pain. Massage therapy can give them a reset, releasing tight muscles, improving mobility, reducing stress, and restoring energy to keep doing the work that keeps the rest of us healthy. For those who give so much, massage isn't just an indulgence, it's recovery.
Yeah, I do agree.
So, Lianna, what physical demands do nurses and healthcare workers experience that make them especially prone to injuries and pain and tension?
Yeah, so we all know that they do a lot of long hours standing, lifting patients, bending, twisting, pushing beds, working in a very stressful environment. And sometimes the lack of sleeping on the night shift, right? So everything there is it's just physically and emotionally demanding. So yeah, there's definitely we can help a lot of them.
Excellent. What areas of the body do you most commonly see affected in the clients who come in that are in this industry?
A lot of nurses we see definitely is like the hips kind of issue, neck, shoulders, lower back, wrist and feet. So I even have a client who just got have a wrist injury from to trying to get helping a client to get up, so just to get her wrist like that, and it's still injured until now. So, so it's pretty demanding physically. So yeah.
That's amazing, because I think a lot of people think of nurses as being on their feet, but not really realizing exactly how physical their job is.
Yeah, exactly. Mm-hmm.
How does constant lifting, bending, and patient handling impact the muscles and joints over time?
Yeah, so there's muscle fatigue, right? Because you use them a lot, and then joints being compressed, posture shifts, and repetitive micro strains accumulate with all those physical demands. Mm-hmm.
Okay. So why is massage therapy an effective way to counteract the physicality of a job in a healthcare industry?
Yeah, well, massage, reduces strain, right? Tension, and it improves the mobility of your muscle, of your body, supports recovery, and relieves physical and mental stress. Like even able to sleep well after a massage, or you just like feel relaxed. Your body just like really need those like muscle tension to just go and melt, right? So those are really important. And if they're having like an injury or anything that they hurt, then massage can help them as well.
That's a really interesting point that you brought up about being able to sleep at night. Mm-hmm. I don't think people realize the emotional toll that nurses have in their career and how much they take it home.
Yeah, exactly.
They deal with a lot of heavy topics and then they go home.
Yeah.
So you recommend massage therapy to help with that emotional release?
Yes, yeah. Even just be able to just relax and sleep well at the end of the day, Yeah, so that's really important.
Excellent. And sleeping well will help ensure that they are rested so they can do their best work the next day.
Yeah. Yeah. So sleep will definitely restore, right? Our body it's like new again the next day. So it's really, really important to have the good sleep. You're getting that sleep.
Perfect. And what about manual osteopathy? I know that that's a service that you offer at your clinic. Can osteopathy help nurses and healthcare workers as well?
Yes, I actually see a lot of nurses as well that, asking for alignment because lots of them having, standing all day and stuff. So a lot of like imbalance from hip down, right? So like leg, ankle. So I just be able to get alignment to the body and make sure that foundation is nice and is moving well. You'll be able to you move well to your whatever physical demand that the nurse will do, right? So it's
Right.
really, really important to get in, even if you're just curious about it. Okay, anything misalignment, like you look at the mirror saying like, yeah, why am I shoulder like this? Or why am I walking different? Although there's no pain yet. So these things are a start to kind of see, okay, there's definitely imbalance there. So, yeah, come see for an manual osteopathic treatment to check and see what's going on.
Excellent. And do you recommend both massage therapy and manual osteopathy?
Yes, yeah, I try get them to see in between because they always complement each other. So.
Right. Yeah, massage therapy works on like the muscles and connective tissue, and then the manual osteopathy works on like their structure as a body.
Yeah, yeah.
What role does stress play in the physical pain nurses report when they come to see you?
So stress increases muscle tension and lowers recovery if there's anything if they hurt themselves, right? So massage reduces stress hormones and relieve tightness. So increase, helping our body to release those happy hormones so that we can relax, right? So yeah, that's how it can help with stress.
That's great. It's not just the relaxation part of it. It's actually releasing the chemicals that will physically help us relax and fall asleep.
Yeah.
And Lianna, do you find that improving mobility and reducing tension helps healthcare workers perform better on their job?
Yes, because if you're mobile, you're actually moving better. That means it's a safer lifting, right? So you can safely lift a patient. You have a smoother movement. You're not just like stiff and you can't reach anything, or it's just reduce the whole risk of injury when you're mobile.
And Lianna, how quickly do nurses typically notice benefits from massage therapy? Do they get relief after one session? Do they need multiple treatments?
Often immediately they feel the relief after a treatment. Within 1 or 2 sessions, clients find that they feel lighter. They get less stiff and then less pain, more mobile. But we actually love our nurses clients are definitely regular, and they really do feel that they really need the massage to get them going and just kind of make them feel better. So some nurses that haven't been to massage, definitely try and see how this can help you. And
that's good to know. So that they get the immediate benefit from the hormone release from their first massage, and then the future massages can help attack the pain that they feel.
Yeah, get them keep moving better, right? Be mobile and
And would you say they need to have regular massages? Like I know some nurses that are like, oh, I can fit in 1 or 2 massages a year. Do they need more regular than that?
Yes, yeah. Everyone needs a regular massage no matter what we do, right? Because we're working, so that means we're using the same muscles over and over again. So we have repetitive muscle that's getting used a lot. So those needs to be relaxed, to be massaged, to be, let go of those tensions. So yeah, definitely needed. Not just once or twice a year as a treat. No, needed for sure.
And what are the long-term benefits from doing massage therapy regularly for a long period of time?
Yeah, so we can see less chronic pain. It's like even if it will hurt because you use them a lot, it will not be nagging, for like a week, right? So it will eventually get better the next day or so. So that's a good thing. And then of course their posture will improve, faster recovery if there's anything that if they hurt themselves, and better energy levels.
Wow. So long-term benefits, do it not just when you hurt, but keep doing it regularly.
Yeah.
And make it a part of your practice.
Yeah.
Perfect. And so what advice would you give a nurse or a healthcare worker that is experiencing chronic pain or just stress in their day-to-day life? What would you say to them?
Yeah. So even if they're busy, because, life gets busy but then they have this pain, but they're busy. But, you just have to remember that your body is like, there's a saying that if you don't take care of your body, where will you live? So it's like, if you don't take care of, it's just an hour of massage in a month, right? So how many hours in a month? You're just taking 1 hour of your time to give for yourself, and just take the treatment that you needed and you deserve, because you help a lot of people. So, even one massage session in a month will make a huge difference, meaningful difference to you. And if you care for others, you must definitely care for your own body. So
that's great. Yeah. If you don't take care of yourself, how can you take care of others?
Yeah.
Excellent. And I believe that you're open 7 days a week and have some late appointments. So even nurses can find time at your clinic.
Yeah. We're open Monday to Friday, 9 to 9 p.m. And then also weekends, 9 to 5 p.m. So there is no excuse. You can see us. So
whichever one day a week you get off, or one day a month. I know some nurses are pulling a lot of shifts. You can get in to Healing Point Massage Therapy.
Yeah. And you can always call us 780-569-3838 to book an appointment. Or you can, if you're get off your shift in 5 a.m., then you can book online at healingpointmassage.ca. We have an online booking there that you can check out.
Perfect. So no excuses.
Yes.
Great. So if you are a nurse or a healthcare worker that needs to take care of themselves, or you love a nurse or a healthcare worker and you know that they need to take care of themselves, please send them this video. Get them to book in at Healing Point Massage Therapy. You could even buy them a gift card. They would love to get that as a gift, I'm sure. Also, if you like this video, please hit the like button. That'll allow us to keep making videos like this for the future. If you have any questions, please leave a comment below and Lianna will get back to you with an answer, or we'll make a new video for that question. And please subscribe to the Healing Point Massage Therapy channel. We want you to get all of the newest content as soon as it comes. So thanks so much for joining us. Thanks, Lianna, for the great information. I learned a lot today.
Thank you so much.
Okay. See you next time.
See you.